Good morning everyone. Mr. Subbarao came to me with a very gross arthritis and is not able to do a lot of activities. He's been postponing the surgery for many years, even though he knows he has to undergo surgery. Probably lack of confidence and lack of trust in the surgical procedure. We as a team counseled him thoroughly and put him the realistic goals, what he can achieve in what time. So unfortunately, the surgery worked very well. We did a conventional total knee replacement, bilateral, for him together, and he recovered just like magic. Within 15 days, he started walking independently. He did not need any support, and he's doing all his activities within 2 to 3 weeks of surgery. And this will transform his life to much more evolving and productive to the society. So most of the geriatric age population are worried more than the cost of the surgery, worried for the complications of the surgery.
ಸುಮಾರು 12 ವರ್ಷಗಳಿಂದ ಈ ಮೊಣಕಾಲು ನೋವು ತುಂಬ ಕ್ಯೂಟಾಗಿ ಅನುಭವಿಸ್ತಾ ಇದ್ದೆ. ನಾನು ಎಷ್ಟು ಪ್ರಯತ್ನ ಮಾಡಿದೆ, ಹಾಗೇನೆ ನ್ಯಾಚುರಲ್ ಆಗಿ ಅದನ್ನು ಅವಾಯ್ಡ್ ಮಾಡೋಕ್ಕಂತ, ಅದರ ಆಗದೆ ಕೊನೆಗೆ ಆಸ್ಪತ್ರೆ, ಸ್ಪರ್ಶ ಆಸ್ಪತ್ರೆ ಒಳ್ಳೆ ಹೆಸರುವಾಸಿ. ಮೊದಲು ನಮ್ಮ ಅಣ್ಣನವ್ರ ಆಪರೇಷನ್ ಆಗಿತ್ತು, ಹಾಗೆ ಮತ್ತು ಅಲ್ಲೇ ಮಾಡಿಸೋದು. ಎಲ್ಲ ಸ್ಟಾಫು, ಡಾಕ್ಟರ್ಗಳು ತುಂಬ ಸಹೃದಯದಿಂದ ತುಂಬ ಚೆನ್ನಾಗಿ ಟ್ರೀಟ್ ಮಾಡುತ್ತಾರೆ. ಅವರೆಲ್ಲರಿಗೂ ನನ್ನ ಧನ್ಯವಾದಗಳು. ನಾನು ಈಗ ತುಂಬ ಚೆನ್ನಾಗಿ ನಡೀತಾ ಇದ್ದೇನೆ. ಕೊಟ್ಟದ್ದು ಔಷಧ ಕೂಡ ತುಂಬ ಚೆನ್ನಾಗಿ ಕೊಟ್ಟಿದ್ದಾರೆ. ಸೊ ನಾನು ತುಂಬ ಅತಿ ವೇಗದಲ್ಲಿ ಚೇತರಿಸಿಕೊಂಡು ನಾನೀಗ ನಡೆಯಲು ಆಗುತ್ತಿದ್ದೇನೆ.
Mr. Subbarao recovered to the maximum level. So today he can do almost every work with happily. So that much magical transformation can a bilateral total knee replacement surgery can get for anyone who is having crippling arthritis, who is a deserved candidate. Thank you.